Good morning, everyone. I'm Dr. Akash Vishwe, working in Index Medical College as assistant professor in the Department of Pharmacology. So today we are going to study and discuss about vitamins and minerals. So as you know, all very well, basically about vitamins and minerals. So first, we are going to study about vitamins. Okay, so what are the vitamins? So vitamins are non-caloric organic nutrients. These needed in very small amounts in the daily routine. So what are the facilitators of the vitamins? So they help body processes to properly proceed, like about digestion, about absorption, metabolism, and growth, etc. Some appear in food as precursors or provitamins. So what are the types or classification of the vitamins? So these are basically divided into the two types. One is the fat soluble vitamins, another one are the water soluble vitamins. So the different categories of the vitamins are included in both type of categories are first uh, the fat soluble vitamins. So vitamin A, D, E, and K are included in the this category. And when we are going to talk about the water soluble vitamins, so these include vitamin B complex, vitamin C, and folic acid. Fat versus water soluble vitamins. So what are the basic differences in between these both type of vitamins? So first, when we talk about absorption in the water soluble vitamins, they directly absorb into the blood. But when you talk about the fat soluble vitamins, so they absorb into the lymph. Water soluble vitamins transport freely throughout the body, and fat soluble vitamins, their transport require some carriers. Water soluble vitamins stored finally into the circulatory freely, while the fat soluble vitamins storage is there in the cells with the fat. The excretion of the water soluble vitamin is through the urine, but fat soluble vitamins excrete out uh, not in the urine, but they actually stored with the fat. When we talk about the toxicity of the water soluble vitamin, so they are actually less toxic, but the fat soluble vitamins are somewhat little bit more toxic. So what is the requirement of the fat soluble vitamin? So every day is not needed, uh, uh, except these are required within 2 to 3 days. But fat soluble vitamins are required every week. Water soluble vitamins. Now we are going to study. So they actually found in the vegetables, fruits, and grains and meat. They absorb directly into the bloodstream, as we know earlier, and they are not stored in the body, and toxicity is rare. Alcohol can increase the elimination, smoking, etc., and this cause decreased absorption of these vitamins. Now, step by step, we are going to get the detailed study about these vitamins. So here we have the vitamin B1 or thiamine. It is known as thiamine also. So what are the sources of thiamine? So wheat, cereals, pulses, nuts, fish, meat, egg, milk, vegetables, and fruits, etc. So these are the rich sources of the vitamin B1 or thiamine. So what is the daily requirement? It's a 1 to 2 milligram required per day. So about functions of the thiamine. So it works as a coenzyme for carbohydrate metabolism. It is essential for the transmission of nerve impulses. So what are now here, we are going to study about what are the deficiency symptoms of the vitamin B1. So there is occurrence of a specific disease that is known as beriberi. So it has actually two types. One is dry beriberi and another one is the wet beriberi. So the dry beriberi nervous system is affected. It causes the peripheral neuritis, tingling sensation, numbness, and it can cause the muscular weakness. While in the wet beriberi, it affects the uh, heart. So it can cause the tachycardia, palpitation, and cardiac failure. So now at last, about the uses of the thiamine. Uh, it can be used in the patients which are on the hemodialysis in the condition of severe vomiting, and it can be used, and in chronic alcoholics it can also be used. So this is here a diagram which is showing the condition of a patient which is suffering with the beriberi. So as we can see, it's a diagram of the patient of which is suffering with dry beriberi. The symptoms are the dyspnea, orthopnea, foot drop, numbness, paresthesia, loss of reflexes in the knees and feet. So, and it can cause also the painful tenderness of the muscles also. So these are some examples of the dry beriberi. Now, we have another vitamin that is known as a vitamin B2, that is riboflavin. So what are the sources? So sources of this vitamin is uh, cereals, on pulses, liver, meat, egg, and milk. So the daily requirement of the vitamin B2 or riboflavin is 2 to 3 milligram per day. Functions of this vitamin are, as it can work as a coenzyme in oxidation reduction reaction. So the deficiency symptoms of riboflavin are glossitis, cheilosis, stomatitis, seborrheic dermatitis. Uses of riboflavin or vitamin B2. It can be used in the condition of prophylaxis or the treatment of the vitamin B12 deficiency. So what are the specific deficiency? So we also studied about this. Now we have the vitamin B3 or niacin. So it is a very essential vitamin which is required daily. So the sources of this vitamin niacin are liver, meat, fish, egg, and groundnut. The daily requirement of niacin is 50 to 20 milligram. Functions of the niacin of vitamin B3. So it is actually necessary for the carbohydrate and protein metabolism. The deficiency symptoms of niacin are diarrhea, dermatitis, dementia, and pellagra. So what now here we are going to focus about the uses of niacin. So we can use it in the prophylaxis and the treatment of a specific disease that is known as pellagra. And along with this, we can also use this vitamin B3 uh, as a hypolipidemic agent. When the level of cholesterol increases, in that condition, we can use this. So here we have a diagram of the condition specific which is related with the deficiency of vitamin B3, that is pellagra. So here we can see the patchy skin on the cheek and tongue. So what is this? It is an inability to absorb niacin or vitamin B3 or the amino acid tryptophan may cause pellagra, a disease characterized by scaly sores, mucosal changes, and mental symptoms in the patient. So this is a very essential vitamin which is required daily to prevent this condition, pellagra. Now, the another vitamin is known as pyridoxine, that is vitamin B6, pyridoxine. So the sources of vitamin B6 are bean, liver, meat, fish, egg, cereals, milk, and vegetables. The daily requirement of pyridoxine is 2 milligram. The functions of vitamin B6 are, it is involved in the carbohydrate, fat, and protein metabolism. So now here the deficiency symptoms of the pyridoxine. So these are peripheral neuritis, anemia, and convulsions. Now here we are focusing the uses. So it can be used for the prophylaxis and treatment of the vitamin B6 deficiency. Isoniazid, the drug is specifically used in the treatment of tuberculosis. When we use this drug, it can cause a specific ADR that is known as the peripheral neuropathy. So to avoid this or for its treatment, we can add the specific this vitamin, that vitamin B6. So if vitamin B6 is added with the isoniazid, so we use this as the treatment of the peripheral neuropathy. Now, vitamin B1 plus B12 plus B6, these three combination of the vitamin B complex can be used for the treatment of neuropathies, which is related with different kind of conditions. Now, we have the last vitamin of the vitamin B complex category. So now we have the vitamin B12, or known as the cyanocobalamin. So the sources of cyanocobalamin are liver, meat, fish, and egg, and it can be synthesized by the bacteria in the colon. The daily requirement of the cyanocobalamin is 1 microgram. Functions of vitamin B12 or cyanocobalamin are, so it is actually essential for the DNA synthesis. To improve this condition, we can add the folic acid with vitamin B12. Specific deficiency symptoms are of this vitamin are peripheral neuritis, megaloblastic anemia, and pernicious anemia. Different kind of anemias, the deficiency of iron. We can use this. So specific uses. In the condition of megaloblastic anemia, we can use this. Okay. It occurs due to the dietary vitamin B12 deficiency. So if there will be some dietary deficiency, we can add in our food or in the patient's food these dietary sources. So now another use is in the condition of pernicious anemia. We can use this. So pernicious anemia occurs due to vitamin B12 deficiency. Okay, how can it occurs? It is due to vitamin B12 is actually not able to absorb. It is unable to absorb in the intestine because of lack of intrinsic factor. There is actually an intrinsic factor which is found uh, in the stomach, and without its availability or its absence, it is unable to absorb the vitamin B12. So the pernicious anemia occurs. So another use is the vitamin B1 plus B12 plus B6. So this combination of vitamin B complex can be also used in the condition of neuropathies. The significance of vitamin B12, why it is important. So it is important for the metabolism, the formation of the red blood cells, and the maintenance of the central nervous system, which includes the brain and the spinal cord. So it's actually essential thing. So as you can see the diagram of the sources of vitamin B12. So the liver, the meat, the egg, milk, fishes, shellfish, milk, etc. are the dietary sources of the vitamin B12. Now here you can see the diagram of the megaloblastic anemia, particularly specific a big size cell, uh, a bluish diagram of this particular cell that recognizes the condition of megaloblastic anemia, which shows the deficiency of the vitamin B12. So now here the pernicious anemia diagram we have. So due to lack of intrinsic factor, the vitamin B12 is not able to absorb. So this is the condition of pernicious anemia. Folic acid, now the another vitamin. Sources of the folic acid are fresh green leafy vegetables, liver, fruits, milk, egg, and dietary products. Daily requirement of the folic acid is 500 to 800 mcg. Functions of the folic acid are it is active from tetrahydrofolate, and it is essential for the biosynthesis of the amino acids, purines, pyrimidines, and the synthesis of DNA. So it is highly important for the cell division also. So deficiency symptoms are megaloblastic anemia it can cause, and glossitis. Uses of the folic acids are, so it can be used in the condition of megaloblastic anemia, prophylaxis in the pregnancy, and in methotrexate toxicity, which is an anti-cancer drug. So as you can see, the sources of folic acid, it could be liver, yeast, nuts, dried beans, whole grains, spinach and other green leafy vegetables, oranges and avocado. Folic acid is actually necessary for the formation of or production of the red blood cells and the formation of the neural tube. So its deficiency can cause the neural tube defect also. Now the another vitamin we have, that is vitamin C or ascorbic acid. So the sources of ascorbic acid are citrus fruit, tomato, leafy vegetables, germinating pulses, and the breast milk of the mother. Daily requirement of vitamin C is 30 to 50 milligram. Functions of the vitamin C or ascorbic acid are formation of the collagen, bone, teeth, capillaries, and healing of the wounds. Formation of the hemoglobin and maturation of the RBCs. It can also cause. Now, here we have the deficiency symptoms of the vitamin C. So, the specific disease is known as the scurvy, occurs due to deficiency of this vitamin. The symptoms of the scurvy are general weakness, swollen and bleeding gums, loose teeth, conjunctival hemorrhage. It can also cause delayed wound healing, osteoporosis, and anemia. So these all are the symptoms of the specific condition known as the scurvy. Uses prophylaxis. In the condition of prophylaxis, we can use this 50 to 100 mg per day. While in the treatment of scurvy, we can use 500 to 1,500 mg per day. Another uses are healing of wound, and in the condition of fracture, we can use this. To acidify urine in alkaline drug poisoning, we can use this. Ascorbic acid can promote iron absorption from the gut. So this is the diagram of scurvy, what you can see. Okay, so we have the diagram of scurvy here. We can see properly the swollen gums, and there is redness also is there in the gums. So it could be a serious condition. Okay. So now another category of the vitamins, what we are going to study. So this is fat soluble vitamins. So these are found in the fats and oils of the food. It can be absorbed into the lymph and carried in the blood with protein transporters that are known as the chylomicrons. These are stored in the liver and body fat and can become toxic if large amounts are consumed. So vitamin A we have now first in this category, that is known anotherly as retinol. So the sources of vitamin A are leafy vegetables, carrot, pumpkin, mango, orange, papaya, fish liver oil, egg, milk, butter, and cheese. So now the daily requirement of vitamin A is 4,000 IU, international units. The functions of vitamin A are: vitamin A is necessary for the synthesis of retinal pigments required for vision in the dim light. Vitamin A maintains integrity of the epithelial cells. It actually stimulates the cell-mediated immunity. So these are some important functions of the retinol. So now we're talking about the deficiency symptoms of vitamin A. So in the condition of deficiency of vitamin A, it can cause night blindness, xerophthalmia, keratomalacia. It can also cause the dryness of the skin with papular eruptions. Another main condition, it can cause the bitter spot or triangular spot on the eye. So what are the uses of vitamin A? So these are prophylaxis and treatment. So in the condition of prophylaxis, we can use this in the amount of 4,000 international unit per day. In the treatment of night blindness like condition, we can use the vitamin A about 50,000 to 1 lakh international unit per oral for 3 days. And this big amount, if we use, so the condition reverses and it can be normalized to the patient. So here we have the diagram of normal vision, and in this condition we can see some specific structures of the tree or the house. While in the condition of night blindness, there is a more dark area. So the patient is unable to walk and see properly in the condition of night blindness. So here we have another diagram of xerophthalmia. Another here we have in the both eyes of the patient there is keratomalacia. The last diagram which is related with this condition, that is known as the Bitot spot. So it is actually appears as grayish white triangular plaques. It's a triangular, no? So it firmly adherent to the conjunctiva due to increased thickness of conjunctiva in certain areas. So it's a triangular shape thing, which is actually respond very well to the vitamin A. Now, another vitamin we have, that is vitamin D. So the sources of vitamin D are fish liver oil, milk, butter, cheese, synthesized in the skin. It is on the sunlight exposure. So that means if you work in sunlight in the daylight properly, so you will be highly fulfilled with this vitamin. There will be no deficiency. So the daily requirement of the vitamin D is 100 to 200 international units. The functions of the vitamin D are they increase the plasma calcium and phosphate by acting on GIT, kidney, and on the bone. Increases their level, the calcium and phosphate. The deficiency symptoms of vitamin B in the children, it can cause the rickets, while in the adults, it can cause the osteomalacia. Uses, so in the condition of prophylaxis, we use the vitamin D in 400 international units per day. If you are treating the patient, so there is the 4,000 international unit per day use of vitamin D. So here we have a diagram of a child that is suffering with rickets. The legs became bow-shaped and baby is, the child is looking properly sit. So here we have the proper diagram of rickets, childhood rickets. So there is a deficiency of the calcium and phosphate in the bones, especially in the femur. So it can not become properly normal. They became actually bow shaped. Okay, now we have the we have vitamin E, or it is also known as the alpha tocopherol. So sources of vitamin E are wheat germ oil, nuts, cereals, green leaves. The daily requirement of the alpha tocopherol is 5 to 15 milligrams. The functions of the alpha tocopherol are as antioxidant, it can work. Deficiency symptoms of alpha tocopherol. So it affects fertility and degenerative changes in the central nervous system and in the myocardium and in skeletal muscles also. So the use or indications of the vitamin E are in the condition of muscle cramps, and it can be used in the condition of fibrocystic breast disease. Vitamin K, this is the last one in the category of the vitamins. So the sources of vitamin K are spinach, cabbage, cauliflower, tomato, butter, meat, milk, and liver. The daily requirement of the vitamin K is 70 to 140 mcg. Functions of vitamin K are It helps in the synthesis of the clotting factors. The clotting factors are specifically factor 2, 7, 9, and 10. The deficiency symptoms of vitamin K are it can increase the bleeding tendencies. So it is also actually used in the as anticoagulant for different conditions. Uses of vitamin K. So the vitamin K prevents, and it can be used in the treatment of bleeding associated with vitamin K deficiency. It can be routinely given to the neonates. It can be used in the condition of the warfarin toxicity. So this is all about the vitamins. What we have studied, two type of the vitamin. One is the water soluble, another one is the fat soluble. So this is all about vitamins, and in the next lecture we will study about the minerals. Okay, this is all about